My name. Again, my name.
My name is Tanuja.
Okay. Click by procedures and manipulation. Procedures and manipulation.
Here.
Okay, down, down. Okay, blood sampling. Training.
What process should be the following?
Help, read and click.
Patient identification. Read. What process should be the following? Make a few wiggling movements ends with the tube, put on gloves, remove the tube from the holder. Patient identification.
Introduce yourself. Ask the patient's name and date of birth. What process should be the following?
Make sure the patient is in good health. Make a few wiggling movements with the tube. Fixation of a vein with your finger. Hand treatment with antiseptic.
Untimely action.
Read. Hand. No.
Last one.
What do you now clicking? Read.
Make sure the patient is in good health.
Hand treatment with antiseptic.
Yes, ma'am.
Treat your hands with antiseptic.
Help next step.
What process should be the following?
Ask the patient to make a face, choosing the patient position, treatment of the venipuncture site, insert the tube into the needle holder.
Ask the patient to sit or lie down in a comfortable position. What process should be the following?
Loosen the tourniquet, unclench your fist, insert the tube into the needle holder, examine the venipuncture site, put a pillow under your arm.
Under the patient's arm, place a rubber cushion. What process should be the following?
Make sure the patient is in good health, make a few wiggling movements with the tube, preparing the paving, put on gloves.
Wear gloves. What process should be the following?
Examine the venipuncture site, vein puncture, preparing the paving, ask the patient to make a fist. No, ask the patient to make a fist.
Prepare test tubes corresponding to the test kit. Red, yellow, blue color indicators. 3 alcohol and sterile gauze wipes, plaster, bandage. What process should be the following?
Venipuncture, needle selection, labeling the test tubes, insert the tube into the needle holder.
Select the appropriate size needle. Make sure the label on the needle is intact. What process should be the following?
Examine the venipuncture site, ask the patient to make a fist, remove the tube from the holder, remove the cap from the needle.
Examination, the first one.
Examine the site of the proposed puncture. Is it possible to inject without a tourniquet? Presence of skin rashes. What process should be the following?
Ask the patient to take a deep breath, vein puncture, apply a tourniquet, insert the tube into the needle holder.
Apply the tourniquet.
Place a tourniquet 10 to 15 centimeters above the intended puncture site on a sleeve or disposable napkin. What process should be the following?
Ask the patient to take a deep breath, choice of venipuncture site, labeling of test tubes, ask the patient to make a fist.
Ask the patient to make a fist. What process should be the following?
Make a few wiggling movements with the tube, choice of venipuncture site, loosen the tourniquet, unclench your fist, fixation of vein with your finger.
Choice of the venipuncture site.
Select the puncture site by palpation.
Palpation.
What process should be the following?
Vein puncture, treatment of the venipuncture site, insert the tube into the needle holder, assembling the vacuum system.
Treat the puncture area with an alcohol wipe. Wait for the alcohol to evaporate. What process should be the following?
Labeling of test tubes, assembling the vacuum vacuum system. Insert the tube into the needle holder. Vein puncture.
Assembling.
Assemble the vacuum system. Screw the needle into the needle holder. What process should be the following?
Ask the patient to take a deep breath. Loosen a tourniquet, unclench your fist. Fixation of a vein with the finger. Remove the cap from the needle.
Remove the cap from the needle.
Remove the protective cap from the free side of the needle. What process should be the following?
Fixation of a vein with a finger. Apply a pressure dressing. Apply an alcohol wipe to the venipuncture site. Insert the tube into the needle holder.
Fixation of the vein with finger.
Fix the vein by pulling on the patient's skin. What process should be the following?
Insert the tube into the needle holder. Loosen the tourniquet.
Untimely action.
Touch of fist. Labeling of test site tubes. Ask the patient to take a deep breath.
Ask the patient to take the
A-
Play.
Ask the patient to take a deep breath. What process should be the following?
Vein puncture, labeling of test tubes, apply an alcohol, wipe to the venipuncture site, remove the vacuum system from the vein.
vein puncture. First.
Continuing to fix the vein, gently puncture it until you feel a hit in the void. What process should be the following?
Make a few wiggling movements, enters with the tube, remove the vacuum system from the vein, insert the tube into the needle holder, loosen the tourniquet and touch your face.
Insert the tube into the needle holder as far as it will go. What process should be the following?
Remove the vacuum system from the vein, loosen the tourniquet and touch your wrist, apply a pressure dressing, remove the tube from the holder.
As soon as blood begins to flow into the tube, loosen or remove the tourniquet. Make sure the patient has unclenched his fist. What process should be the following?
Remove the tube from the holder, make a few wiggly movements with the tube, apply an alcohol wipe to the venipuncture site. Make sure the patient is in good health.
First remove.
After the blood flow has stopped, remove the tube from the holder, leaving the needle holder system in the vein. What process should be the following? After removing the tube, make a few jiggling movements. What process should be the following?
Make sure the patient is in good health, apply a pressure dressing, labeling the test tubes, apply an alcohol wipe to the venipuncture site.
Apply an alcohol wipe to the puncture site. What process should be the following? After the last tube is filled, remove the needle holder from the vein. What process should be the following?
Apply a pressure dressing, make sure the patient is in good health, labeling of test tubes.
First.
Remove the alcohol wipe from the puncture site and apply pressure dressing. What process should be the following?
Make sure the patient is in good health, labeling of test tubes.
Make sure the patient is in good health. What process should be the following? Label all blood sample tubes. Scenario completed.
Okay, good job. 92. And you like it? Oh, virtual patient. You understanding?
Yes, ma'am.
Okay, we are now again working.